بسم الله الرحمن الرحيم. Welcome again to another new video. Our video today will be about thymic stromal lymphopoietin in dermatologic diseases, and I will cover this in two videos. This is the first one. And before we start, I want to remind you again to subscribe to the channel and activating the alarming bell if you are interested in getting any new video. Here is a nice paper that I summarize the information that came in it, and it is published in Frontiers Immunology in 2021, and its title is Thymic Stromal Lymphopoietin in Cutaneous Immune-Mediated Diseases. Thymic stromal lymphopoietin is a powerful initiator of type 2 allergic inflammation, and its involvement in a variety of conditions including atopic dermatitis, airway allergy, food hypersensitivity reactions, autoimmune disorders, infections, and cancers, has been extensively discussed in numerous reviews. Also, there is evidence linking thymic stromal lymphopoietin to safeguarding the intestine and maintaining homeostatic tolerogenic regulation. Thymic stromal lymphopoietin that is intrinsic to epithelial cells has an apparent effect on the generation of tolerogenic dendritic cells, and also it facilitates the differentiation of regulatory T cells in both the intestine and thymus. And as I described before, that thymic stromal lymphopoietin has two forms, the long form and short form, and long form is specific for the pro-inflammatory effect, while the short form is mainly anti-inflammatory. The immunomodulatory effects of long-form thymic stromal lymphopoietin can vary significantly, as it is both promote the polarization of T helper cells towards T helper 2 and T helper 17 immune responses, and also it can trigger itch. Also, long-form thymic stromal lymphopoietin has been strongly linked to skin fibrosis, epidermal hyperplasia, angiogenesis, and maintaining homeostatic tolerogenic regulations. The functions of thymic stromal lymphopoietin in relation to type 2 allergic responses have been thoroughly investigated. Type 2 immunity is characterized by the prevalence of CD4 T helper 2 cells, eosinophils, mast cells, basophils, and group 2 innate lymphoid cells. And while this type of immunity helps to protect the host from the extracellular parasites, it can also lead to chronic allergies. So various proteases activating receptors and pattern recognition receptors found on the barrier epithelial cells are stimulated by stimuli like proteolytic allergens, bacteria, parasites, and chemicals, and this will lead to the production of thymic stromal lymphopoietin, interleukin 25, and interleukin 33. This scenario is a scenario that happens in T helper 2 responses. In addition to the previous stimuli that lead to the release of T helper 2 cytokines, we have also endogenous danger-associated molecular pattern that can enhance also the release of pro-T helper 2 cytokines by epithelial cells. Thymic stromal lymphopoietin activated dendritic cells are responsible for promoting the differentiation of naive T cells into T helper 2 cells. As a result, CD4 positive T cells generated T helper 2 cytokines such as interleukin 4, 5, 13, and tumor necrosis factor alpha, while the production of interleukin 10 and interferon gamma is decreased. Other studies have demonstrated that thymic stromal lymphopoietin can initiate a rapid maturation of T helper 2 cells, not only through the activation of dendritic cells, but also through binding directly to thymic stromal lymphopoietin receptors expressed on naive CD4 positive T cells, suggesting the potential for earlier activation of T cells stimulated by thymic stromal lymphopoietin. So, thymic stromal lymphopoietin has been associated with innate immunity as it can stimulate the secretion of type 2 cytokines from mast cells and prime type 2 innate lymphoid cells to produce interleukin 5 and interleukin 13 in a manner independent of interleukin 25 and 33. Furthermore, thymic stromal lymphopoietin may play a role in enhancing macrophage polarization. In this diagram, we can see that the release of thymic stromal lymphopoietin from barrier cells like epithelial cells or keratinocytes as a result of stimulation by different stimuli such as allergen, microbes, physical and chemical injuries, cytokines, and this thymic stromal lymphopoietin will act on different immune cells to induce production of type 2 cytokines, like acting on innate lymphoid cells type 2 to produce interleukin 5 and 13, and on dendritic cells. So thymic stromal lymphopoietin will activate dendritic cells, and this will in turn through the OX40 ligand will activate naive T cells to become T helper 2 cytokines. Thymic stromal lymphopoietin can activate directly the naive T cells into T helper 2 cells with the production of interleukin 4, 5, 13, and tumor necrosis factor alpha. As a result of the effect of thymic stromal lymphopoietin on basophils, it's a query and no conclusions till now. But it was suggested that the effect of thymic stromal lymphopoietin in dendritic cells, which will turn activate naive T cells, this will produce interleukin 3 to recruit basophils, which will, as a result, secrete interleukin 4 at the beginning of the immune response. So the involvement of thymic stromal lymphopoietin in the activation of basophils for T helper 2 differentiation remains a subject of significant debate. Basophils have the ability to initiate and exacerbate inflammation by releasing interleukin 4 and are associated with T helper 2 immune response. And as I already explained in the diagram, in an earlier research, it was demonstrated that thymic stromal lymphopoietin activated dendritic cells will prime the naive T cells to secrete interleukin 3 through OX40 ligands activation, and this interleukin 3 secretion can attract the basophils, leading to T helper 2 priming. This sequence of events occurs prior to the production of interleukin 4 by T cells, thereby allowing basophils to act as an earlier source of interleukin 4 for the priming of type 2 immune responses. Numerous studies have suggested that basophils play a key role in polarization, expansion, and progression of T helper 2 immune responses, and they are believed to be important in the development of conditions such as atopic dermatitis, allergic asthma, and rhinitis, and eosinophilic chronic rhinosinusitis. And actually, there is a considerable overlap in the functions of cytokines and chemokines within the T helper 2 immune network, and the molecular interactions within this network may be affected by various factors such as age, genetics, environment, and disease location in patients. Now I'm going to mention the suggested role of thymic stromal lymphopoietin in different types of dermatologic disease. We will start by atopic dermatitis. Thymic stromal lymphopoietin is strongly associated with the development of atopic dermatitis, and the studies have shown that thymic stromal lymphopoietin is overexpressed in keratinocytes in both acute and chronic lesions of atopic dermatitis patients, while its expression is absent in non-affected or non-lesional skin. Also, the expression of thymic stromal lymphopoietin in the stratum corneum is more pronounced in atopic dermatitis patients than control. A correlation was observed between thymic stromal lymphopoietin expression and the scoring atopic dermatitis index, particularly with the stratum corneum hydration and dry skin score, suggesting that the increased expression of thymic stromal lymphopoietin is associated with the dysfunction of the epidermal barrier. Studies also have demonstrated that overexpression of thymic stromal lymphopoietin, specifically in keratinocytes-induced atopic dermatitis lesions, is characterized by alterations in the infiltrate of T helper 2 related cells and increased serum levels of IgE. Also, several studies have demonstrated a close relationship between specific gene polymorphisms and the genetic predisposition to atopic dermatitis. In this diagram, we can see the suggested role played by thymic stromal lymphopoietin in the pathogenesis of atopic dermatitis and psoriasis. So as regard atopic dermatitis, we have here keratinocytes that produce thymic stromal lymphopoietin, and this thymic stromal lymphopoietin will activate innate lymphoid cells type 2 and T helper 2 cells to produce T helper 2 inflammation, and also will activate sensory neurons, which will result in pruritus and fibrocytes, so we have collagen production and skin thickening. On the other side, the suggested role in psoriasis is through thymic stromal lymphopoietin will activate dendritic cells, which will secrete interleukin 23 that will activate T helper 17 cells and make T helper 17 inflammation. Also, thymic stromal lymphopoietin will activate keratinocytes to make epidermal hyperplasia. Pruritus, which is a characteristic symptom of atopic dermatitis, is known to negatively impact the patient's quality of life and can result in persistent scratching. And in turn, this scratching can cause physical damage to the skin, leading to increased cutaneous levels of thymic stromal lymphopoietin in atopic dermatitis patients. To clarify, thymic stromal lymphopoietin has been shown to have an indirect role in causing itching in atopic dermatitis patients by inducing T helper 2 related cytokines that activate sensory neurons. On the other side, thymic stromal lymphopoietin also has been demonstrated to directly trigger itch signals on dorsal root ganglion neurons expressing thymic stromal lymphopoietin receptors. Also, a recent study demonstrated that thymic stromal lymphopoietin is involved in the early stages of atopic dermatitis development by inducing itching, scratching, and skin barrier dysfunction. Thymic stromal lymphopoietin was shown to induce periostin secretion in keratinocytes. Periostin is an extracellular matrix protein involved in tissue remodeling in response to injury. And this periostin can cause itching via periostin receptor expressed on a subset of sensory neurons. Also, in a phase 2 clinical trial that utilized class 3 topical corticosteroids in combination with tezepelumab, which is a thymic stromal lymphopoietin monoclonal antibody that inhibits the binding of thymic stromal lymphopoietin to its receptor complex, have resulted in a reduction in eczema severity scores over placebo at week 12 that was numerically but not statistically significant. However, the treatment produced more substantial responses at week 16. As regards the suggested role of thymic stromal lymphopoietin in the pathogeny of psoriasis, in psoriasis, the primary pathophysiology involves the activation of skin dendritic cells and the induction of T helper 17 signaling mediated by interleukin 23 from dendrocytes. The epidermis of untreated psoriasis vulgaris patients showed a significant increase in thymic stromal lymphopoietin levels. Several experiments have shown that thymic stromal lymphopoietin expression is more pronounced in skin lesion of psoriasis vulgaris patients compared to unaffected skin. Additionally, serum thymic stromal lymphopoietin levels are significantly increased and correlate with the severity of the disease. However, a different study revealed low levels of thymic stromal lymphopoietin expression in psoriatic lesions by immunohistochemical staining. The discrepancies observed in different studies could be due to previous treatment with steroid, which may have suppressed thymic stromal lymphopoietin production. Some recent studies have revealed that thymic stromal lymphopoietin acts as an autocrine and paracrine factor mainly produced by mutant bulge hair follicle stem cells and basal keratinocytes, which can stimulate neighboring or beside non-mutant epidermal cells to overproliferate and express vascular endothelial growth factor, thereby promoting skin inflammation and epidermal hyperplasia in patients with psoriasis. Studies conducted in vitro utilizing primary synovial fibroblasts obtained from psoriatic arthritis patients revealed that thymic stromal lymphopoietin levels were markedly increased in conditioned medium psoriatic arthritis synovial fibroblasts. Also, fibroblasts isolated from psoriatic arthritis synovium were found to induce formation of endothelial cell tubes and enhance angiogenic function via upregulation of thymic stromal lymphopoietin. These findings suggest that blocking thymic stromal lymphopoietin produced by synovial fibroblasts could be a potential strategy to reduce abnormal angiogenesis in psoriatic arthritis patients. Now, this is the end of the first video about the role of thymic stromal lymphopoietin in dermatologic diseases, and we will continue in the next video the suggested role in other diseases other than atopic dermatitis and psoriasis. I hope that you have enjoyed the video, and I'm reminding you again to subscribe to the channel and activating the alarming bell if you are interested in getting any new video, and thank you.